So in this video, we are going to learn how to set up a surgery suite. So this is our room. So we have our surgical table, and then there are these other two tables, so kind of stuff lives here, and then over here is where we typically will set our doctor's gowns, gloves, that kind of thing for them to scrub and then get gowned and gloved up. So when setting up the surgical suite, you'll notice kind of everything is backed away, but this is where everything is going to happen. So our trash can here, we would want on the floor now because we're going to do surgery. So we would have it on the floor. Then this is a heated table, so it needs to be plugged in. And again, our anesthesia machine is here, so of course it needs to be up by our table. So we would pull this up. Ugh. That's good. Always check, make sure that you have ISO in the machine. Obviously, if we don't have gas when we try to anesthetize a patient, you can see it on that bubble. If you try to anesthetize a patient, they're not going to go to sleep because there's no gas. And then up here, so this is our oxygen, labeled oxygen. So back where the oxygen concentrators live, this would be when you would turn on your surgery oxygen. And when this is on, so this switch never ever ever gets flipped to off. It stays on, it should always stay on, never touch this switch. The only thing that you would adjust would be, again, your flow meter as far as your oxygen levels. So we've checked our gas. We're pretending that our oxygen is on. And then over here, your tubing, so bag size, depending on the size of your patient, but you would want to have the appropriate bag size set up. And then our surgery table will get plugged in over here. There is a power strip on the side of our anesthesia machine. So we would plug our surgery table in. And then if you look down here, so this is our temperature control all the way down and then all the way up. One confusing thing, which there is a little note here, but when this green light is on, the table is off. So once we plug it in, we want to press this so our green light goes off. That means that the table is on and is now warming up. Then, so we have our anesthesia machine up by our table. Then our next thing is we want to move our monitoring equipment over to our table. So this is our monitor. And then we would put a towel over top of our table. But then all of our monitoring equipment. So again, making sure that each of these is plugged in to the right hole. So we have our esophageal. This monitors our heart rate as well as temperature. So our esophageal monitor. And then we have our respiratory, so measuring our CO2 levels, and then our breaths per minute. And then we have our SpO2 monitor, so measuring our oxygen concentration. So we would want all three of these things. Typically, we just go ahead and lay them out on the table. And then, like I said, you would have a towel. Then, over here is where our leg ties live. So, and again, depending on what type of surgery you're doing, but especially if a patient is having an abdominal surgery of any type where they're going to be laid on their back, you want 4 of your leg ties. So 1 for each back leg, 1 for each front leg. So again, typically we'll lay 2 up front and then 2 back here on the back of the table. Then we have our actual surgery pack set up. So we want a surgery stand to be at the foot of our table. And then over here is where this top shelf where our surgical packs live. So again, depending on type of surgery you're doing, we have small space, so for smaller dogs, cats, large space, so again, large dogs. Neuter pack, this is only for cat neuters. Dog neuters always get a pack. And then over here on the far left, we have laceration packs, as well as an eye pack for enucleation or any type of eye surgery. And then we have all of our suture options, and then blades all live over here. So if we're doing a spay or a neuter, whatever else. So pull out your pack, set your pack down, and then pull out your blade. You want your blade on the table. We always do a 10 blade, but our 10 blade box isn't open. But here's the differences. So 10 blade, 15 blade. Always lay out a 10 blade. And then again, depending on size of the patient, or if you know what suture the doctor prefers to use, then you'll go ahead and pull out a pack or two of suture and have it laying over here off to the side as well. And then in here we have our surgical gowning, gloving, that type of thing. So again, if you know what size glove the doctor that you're going to be working with uses, you'll go ahead and pull out a pair of sterile gloves. You will pull out a gown. There's mediums and extra larges, so again, depending. But of course, pretty much anybody can wear an extra large, even if that's not actually their size. But you'd have your gown out, your doctor's gloves, your surgical mask, and their cap. And we lay all of that over here. Perfect. And that is pretty much it for surgery setup. There's some other little things, you know, kind of once you learn the doctors, they might want extra drapes or lap sponges, or if you're doing an abdominal explore, you might need suction tubing, or pipettes. You need to pull out your suction, that kind of thing. But for generalized surgery, setting up for surgery day, this is kind of how you want things to go.